So hi, we have this pretty girl. She's also a doctor herself. She's undergone a few procedures when she was a kid. She had a cystic hygroma. She had some procedures in the lower jaw and everything. She has some residual asymmetry and issues, especially with the lower third of the face. The upper third, middle third is very beautiful. So you can see already, this is the upper and the middle third, nicely proportional and very nice. But the lower third, so there's an asymmetry here. And if she turns around, again, there's a huge depression. You can see a scar here. This is from her earlier surgery when she was a kid. I have a scan there. They've put some implants here, some wires and everything. And this side, if you look, it's much better, but still it's coming down. It's not fuller. So the plan for her is, I'm going to be working on the chin. We're going to bring the chin forward in an asymmetrical fashion. Asymmetrical rotational advancement genioplastic kinds. A part of orthomorphic. We're going to be doing jaw sculpting and masseter muscle work here to slim this part. So this is going to go inside, and then this is going to come outside, and this side is also going to go inside. Plus, because there's a huge gap here, soft tissue deficiency from the earlier surgery, I'm also going to be doing work on the outside and doing pexy on the muscle, subcutaneous tissues. So, once this bony protrusion and the bony work is done from inside the mouth, I can do some work here. So we're hoping to improve the asymmetry by this reconstructive surgery. I'm going to show you her scans also. So you can clearly see in this, especially the problem is mainly on her left side. So this is what I was saying about the protrusion. There are some plates and screws, or rather more correctly wires here. This length of the jaw is also way too short than this side. You can see that clearly. It's huge. That's also resulting in the asymmetry. Then there's a bulge here, which I'm going to be working on, the masseter part. And you can see the chin, how it's come as a twisted form. So to correct it, we're going to be doing an extended sliding asymmetrical rotational advancement genioplasty. And obviously on this side also, work here and on the soft tissue. Upper jaw is fine. She's already on braces, as you can see. Not going to be touching anything there. All the wisdom teeth need to go as well, but she's going to get that done later on, 6 months to 1 year after this surgery. Thank you.
Hello everyone, so I've been talking with this young girl. She's got over all her education part of hers, and she's come here, finally taken off some time for the surgery. She has been in touch with us since a long time for her jaw condition. Now if we see, she had a defect or a deformity so as to say at birth, which was a huge expensile swelling along the left condylar region of her face, that is right below the ear. She was operated at a very tiny age. She probably doesn't remember, and was diagnosed as cystic hygroma. Following the surgery, there was a lot of scarring and fibrosis, and it resulted in facial asymmetry. So as we see, and as Dr. Richardson has explained, there is asymmetry particularly in the lower 1/3 of the face. So if you see the lower 1/3 of the face, there is a bulge here. And also there's a grooving right next to it. So there's an indentation, as we see, and a scar. This scar is because she underwent facial asymmetry correction at around 11 or 12 years of age by an extraoral approach that has resulted in a dimpling and a depression, so as to say, and a scarring on this region. When we have a look at her scans, we see that for her, some sort of wire osteosynthesis has been done along the left angle of the mandible. There are a lot of hardware that we can see. Also, she has a tooth which is deeply impacted this side. So the defect, so as to say, is along the mandible, which is the lower jaw. That has to be corrected to maintain harmony, to give her a uniform face, to make her face relatively symmetric. That's the goal for today. So we'll see how it goes, and also we'll see how she is at the time of discharge. Thank you.
So we're going to be taking care of this, hollowing the asymmetry on the chin, asymmetry on the body angle, and the entire lower third of the face. Symmetry involving the entire lower third of the face. So we have corrected all of that. Chin, angle, body. Then we're going to show you. There was also a large impression that we fixed. There was a huge hollowing there, so that has been taken care from outside, and the rest of it from inside the mouth. So there was already a scar there, a bad one, a thick one. It's been revised. Okay, we're going to show you how she looked. Yeah, you can show that scar now. Okay, chin was so much inside. So the scar also will be very minimal because I removed. Wow, that's come out very well. Okay. Oh shucks. Okay, that's nice. This is going to hurt a bit, huh? And this is what now? 8th day, 7th day?
It's the 8th day.
So she had complex facial asymmetry, and we did multiple procedures. And well, I think we've augmented her facial aesthetic significantly. We're going to show you how she looked in a while. So first you can see the asymmetry that was there, because we can also see the side view, you know. Yeah, but this is the side view that she had. You want to look at me a little bit? This side? Yeah, a little bit. So she had a huge hollowing there. That was from the earlier surgery. And then there was a huge muscle bulk here and a bony projection. Bony projection contoured, muscle projection reduced, and we basically moved it down to give the normal contouring. That's one of the major work that was done. And then, yeah, you can see in this picture too. Sorry, it's not the best pictures that we have. Okay. And then, and this is a side view from this side, where you will notice very clearly that the chin has been augmented. So the chin has come forward. Again, you can see, hey, where did you have a look? Come on, give her a mirror. So, so she's also a doctor. So, and a very nice doctor. Look that side. So to your left, so you can see the difference. See, there is no jawline defined. Now you see how it's sticking forward. Earlier there was like you know, the neck jaw line was almost a straight line. And we've given you a chin. So 1, 2, okay. Then you move on to the asymmetry part. Look at this. Well, I'm not saying it's 100% okay, but it's improved. बहुत improve है, okay. ये अंदर जाएगा काफी और, and तो फिर ये सब सूजन कम होगा. There will be good, much improved symmetry. Sorry. So this is the front view, and yeah, as you see, I'll remove this now. Okay. It's going to get better, doc. Okay. So you send us pictures after 4 weeks. Take very good care. Now, there are a couple of areas we are concerned about your intraoral healing. Yeah, so we'll wait there. We'll apply some gel, and it might take another week or so. And then the swelling all will take maybe 4 weeks. Darad ho raha hai kahin? Not much pain anywhere, right?
Just bleeding intraorally.
Little now and then. But no pain anywhere. That's awesome. And you're taking good care, good intraoral care, good diet, and no sleeping, preferably on both the sides. But if you have to sleep on a side, choose the right. Left is really no. Okay? And one scar cream for this, and some tablets for reducing swelling, and all the best.
Thank you.
And be in touch. So let us know how you're doing after a few weeks. We're also going to give you a dedicated follow-up number. Okay? Anything you want to tell me, subscribers? Kuch nahi?
I just want to thank you. Thank you so much, sir.
You're
Thank you
welcome.
so much.
Take care. This side, kind of lot, but it's still going to be, not exactly like this side. So some minimal thing we can. But it has to heal for 6 months. Before that, you don't touch because maybe you don't need much. I think you need much, but still. From front, maybe enough. If you do this and this, different might be open.
Okay,
All right, take care.
thank you so much, sir.
Welcome, man.
It's just a
Arey,
small thing from us.
this is from where?
Bangalore.
Really?
Yeah.
Thanks a lot.
Forget photo ले ले आपको बस.
Yeah. Why not? Take on my own phone and post from. Wait. Why is it showing now?